Hello everyone, I'm Allison. We're going to talk about benzodiazepine today. Benzodiazepine are used for diverse collection of medical conditions, including anxiety, seizure disorder, muscle spasms, pre-medication for medical procedure and anesthesia, and alcohol withdrawal. How this medication works? Benzodiazepine acts by binding the GABA receptor chloride channel molecule. These drugs are enhanced effective of GABA, which is natural inhibitory neurotransmitter found throughout the brain. The GABA inhibits the activity of signal receiving neuron by interacting with the GABA A receptor in these cells. The GABA A receptor is a channel-forming protein that allows the passage of a chloride ion into the cell. Benzodiazepine enhances GABA's inhibitory effect by increasing the frequency of chloride channel opening, leading to greater neuron inhibition. As a result, the neuron becoming more negatively charged and less likely to fire, producing calming and sedation effect. So it's kind of complicated, but easy version of this one is first, our brain constantly tries to maintain a balance between excitation and inhibition. GABA works as an inhibitory neurotransmitter, meaning that decreases neuron activities. Basically, GABA neurotransmitter has on their message that telling us it's fine, you don't have to be like this crazy, just relax. When GABA binds to GABA A receptor, the neuron become calmer and less active, which helps the body relax. So what kind of medication is benzodiazepine? These medications are alprazolam. We know this medication as Xanax. Diazepam, lorazepam, chlordiazepoxide, clorazepate, oxazepam, clonazepam. Adverse effect of benzodiazepine is CNS depression, such as sedation, lightheadedness, ataxia, decreased cognitive function. Difficulty recalling events after taking the medication. Acute toxicity like drowsiness, lethargic, confusion, especially IV toxicity with diazepam and lorazepam may lead to respiratory depression, which is a huge one with the benzodiazepine. Severe hypotension, cardiac or respiratory arrest that can occur. Patients' education. Observe CNS depression and instruct the patients to notify the provider if effects occur. Advise the client to avoid hazard activities like driving, operating heavy machinery or equipment. If toxicity occurred, antidote is flumazenil to reverse sedation and other adverse effects. It's also important to monitor respiratory rate due to respiratory depression. The client who have been taking diazepam regularly in high doses to taper the dose over several weeks because of withdrawal symptoms. But with short-time use, withdrawal effects are not common. Advise the client to avoid alcohol or other substances that cause CNS depression. Diazepam is a pregnancy risk category D medication and classified under Schedule 5 of the Controlled Substance Act. Also, Benzodiazepine is contraindicated in the client who has sleep apnea, respiratory depression, or glaucoma. Be careful to use the patients who has liver disease or history of mental illness or a substance use disorder. Benzodiazepine are generally used short-term due to the risk of dependency. Alright, that's it. Thank you for watching my video and I hope it's helpful. Happy study!